I'm Dr. DC Sharma, consultant endocrinologist and former professor of endocrinology from Udaipur, Rajasthan.
Hi, I'm Donna Ryan, and I am currently president of the World Obesity Federation. I worked for about 30 years at the Pennington Center in the USA, which is a big obesity research center.
So, Dr. Donna, let us first discuss the magnitude of the problem. How common is obesity? I think this is growing in Western population especially.
Absolutely. Well, it's a worldwide epidemic. In the U.S., there are 2/3 of the population has either overweight or obesity. And about 40% of the U.S. population has a BMI over 40. What about India?
See, with the changing lifestyle and the westernization and the lifestyle we are adopting from you, the obesity is growing in our country as well. The recent estimates say that around 30 to 40% of urban population in India is affected by overweight or obesity, and rural India is not untouched. Even in rural areas, there is a tremendous rise in obesity prevalence. Some estimates say that the obesity affects around 12 to 20% of rural India as well, and this is ever growing.
And you know, I think the problem in India is a little different in the U.S. because of the way body fat is stored among the Indian population.
I fully agree with you that, and the evidence also says that for the same amount of height-weight ratio, we call it as BMI. For the same BMI, we have more bad fat, that is central obesity, the visceral fat, which is affected, which leads to hypertension associated with heart disease, diabetes, and likewise. So for lesser body weight, we have more problems.
That's exactly right. I mean, so it's of great concern.
Yeah.
And I think in India, the burden of type 2 diabetes associated with this excess visceral adiposity is the great concern.
Yeah. Not only diabetes, blood pressure, and in parallel, the heart disease is growing.
So we had a great time talking about pharmacotherapy.
So you are an obesity specialist.
Yeah.
You have done a lot of research and still active in research at the forefront in the world. So we would like to ask you how to approach. I mean, it's a common problem in the clinics when an obese person comes to you for the help. What is the flow of the points in your mind? How do we go ahead?
You know, I think we need to not be afraid of using medications to help our patients succeed with weight loss. We all know that the pathway to losing weight is eating less and exercising more. But when our patients try to do this on their own, we know that only about 1 in 5 will succeed with losing even 5% weight loss. So the problem really is a biologic problem. Our body's biology fights weight loss, and we need to fight biology with biology. We need to use medications to help those patients who are struggling, who can't achieve weight loss on their own, to achieve the health benefits of weight loss.
Yeah. So good number of people will require medications, but you also emphasize on the lifestyle modification.
Absolutely.
Changing the diet, the exercise, that remains the cornerstone of therapy, whether you are on medications or whether you are going for surgery. The lifestyle change has to be kept in mind always.
Absolutely, absolutely. So, Dr. Sharma, you know, we must marry the medication to the lifestyle intervention.
That's
because
great.
The way the medications are working is they're helping the patients better adhere to that lower calorie intake.
So there are a number of medications available for obesity management in USA. So would you just enumerate the number of drugs available?
Yeah, we currently have 6 medications that have been approved for weight management in the U.S. One of them, phentermine, is approved only for short-term use, but we have 5 medications approved for long-term use. And we need that long-term use because obesity is a chronic disease. So we have Orlistat, we have Larcaserin, we have phentermine and topiramate, we have naltrexone and bupropion combination, and the last one is an injectable liraglutide 3 milligrams. What about India?
In India, we have two groups of drugs available to us. The Orlistat and recently lorcaserin has also been made available to us. Orlistat is available to us for past more than 20 years and lorcaserin we have started using past 2-3 months.
Yeah, I think when doctors try to start prescribing for weight management, they don't have confidence because this is something new for them. So now you have two medications, one of them very new in India. So one thing we talked about together was the rules for prescribing. And like in all of medicine, the number one rule is, first of all, do no harm. So how do you interpret that for medications for weight management?
Obviously, I mean, do no harm, and while you are choosing a drug, it should be chosen for appropriate patients. So appropriate drug for the appropriate patient. Keep in mind that this won't cause any side effects and this will be effective. And while you are prescribing a drug, let me ask you, there are patients who are obese and they also have hypertension, they are also depressed, they are taking multiple medications for maybe blood pressure, for heart disease. So maybe some of the medications may be contributing to weight gain.
That was our rule number 2.
Right.
Before you write the prescription, maybe you ought to look at the medication list that the patient is already on, because many of the medications we're writing for diabetes, for depression, even for blood pressure control and for contraception can drive weight gain. And we can get some weight loss without prescribing a new medication, just by adjusting the old medication.
That's a very important point that you should keep in mind, and you should always keep reviewing the list of drugs the patient is taking. But again, emphasize the role of antidepressants, antipsychotics, some of the antihypertensives, beta blockers. They add to the weight gain. And maybe drug is not working, maybe you prescribe the drug for weight loss and it's not working. It's because of other medication which is leading to weight gain. So this is very important to keep in mind always.
Those medications that drive gain can oppose weight loss. So that's really important. But I think it's also important for our third rule, and that was that that these weight loss medications do not work in every patient. So there's an enormous variation in the amount of weight loss patients are going to get with these drugs. And so we have stopping rules. We give the medication for about 12 weeks. If the patient is doing well, we continue. We want to see them lose about 5% in the first 12 weeks. And then if they keep going, if they have done that, and they're going to end up with more than 10% weight loss at a year.
This is very important that you keep in mind what you expect from the drug, how much weight loss you expect from the drugs, and over how much period you expect weight loss. And very important point you mentioned that if the drug is not working at 12 to 16 weeks, maybe it won't work. So don't waste time and money of the patient. We change over. We change the strategy. We re-emphasize the lifestyle, and maybe we go to the next drug.
Exactly. I think the next rule we talked about was the importance of talking to the patient. So we call this shared decision making. So in medicine around weight management, this is not so much something that you write the prescription like you're writing a statin and give it to the patient. All the patient has to do is take the medication. So we have to talk to our patients about how these drugs work, because if we don't, then they're not going to be as effective. The patients have to understand that what the medication is doing is it's helping them better adhere to their dietary intentions.
So patient has to be an important member of the team of weight management.
Absolutely.
And patient has to understand the role of lifestyle, the effects and ill effects of the drug. And it has to be shared decision to start and to continue.
And
what is the next rule?
Well, wait, before we go to that, DC, the person who has to change the lifestyle is not the doctor, it's the patient. Right? So the patient has to really be engaged in it. Let's see, what is our last rule on this? I think our last rule is that look, if these medications work to produce weight loss, why would you stop them? We want these medications to be given over the long term. That means forever. So just like medicines for diabetes, just like medicines for blood pressure, just like medicines for lipid, if the patients have a good response, keep it up.
So this is very important to understand, because most of the patients expect that this drug would be given for 2 months, 3 months,
Yeah.
they lose weight and they would be able to stop it.
Yeah.
So they have to continue it for a longer period, maybe lifelong, in order to achieve and maintain the weight loss.
Yeah, you know, it's everybody wants to be cured, but there is no cure for obesity. It is a chronic disease, and we absolutely must use these medications to help sustain that hard-won weight loss. Because if not, the body's biology just drives the weight back up again.
And what is the last rule?
That was my last rule.
Okay, fine. so we thank you for the wonderful rules you mentioned, and it is very important. I re-emphasize the shared decision. Patient has to understand and what patient is going to achieve, and the importance of lifestyle.
That's right.
Thank
That's
you.
right. Yes. Thank you so much
you
for
so much.
doing this with
Yeah,
me.
thank
I
you.
enjoyed it.